I have another gentleman who is signed up to testify but had to leave because he's got a 4-hour drive and has to get up really early in the morning. I know. But he's on the list, Andrew Atkinson, if you want to take him off, okay? And I submitted his testimony in writing over here. Senator Millett, Representative Cornfield, and members of the Joint Standing Committee of Education and Cultural Affairs. Good evening. My name is Corey Schwinn, and I reside in Marshfield, Maine. I am a licensed clinical social worker and certified clinical supervisor by profession, and very involved community member by choice. Professionally, I held many positions, including a director of mental health crisis program, and am currently the clinical director for a nonprofit agency providing the range of behavioral health and intellectual disability services to all ages. In the community, I volunteer in a number of formal positions, including being on the board of the local hospital, former president of the local Little League, and served on a governor-appointed position on the Board of Visitors for Downey's Correctional Facility. I value community, youth, connections, activity, and health. I'm in a position to observe a broad range of community and family experiences. I come to you today to briefly share my concerns about LD 798. About a year ago, during a routine physical, we were informed that my oldest was due for her vaccinations, including the HPV vaccine. My wife, who is a registered nurse and is currently the director of the surgical department, had some reservations regarding the vaccination. We chose to delay until we could do some more research. As a family, we researched the vaccine, and my wife had a number of conversations with medical providers regarding the risks and benefits. In the end, we chose to vaccinate our daughter. Our children are fully vaccinated, with the exception of the seasonal flu shot. We are more comfortable with our decision to vaccinate because we had the opportunity to research and discuss with our medical providers before making an informed choice to vaccinate. LD 798 would deny all Maine parents this opportunity that was so important to my family. Informed consent is a hallmark of our treatment community. You've heard that a number of times today. I am ethically and legally obligated to provide informed consent in my profession. As an example, the Department of Health and Human Services publishes the Rights of Recipients of Mental Health Services, which is a regulatory handbook for client rights. In this document, there are 12 pages dedicated to informed consent. I abide by these 12 pages when I provide talk therapy. No chemicals are injected or involved. LD 798 requires all to vaccinate and eliminates the inherent parent right of choice. As you have heard, or likely will hear today, there are medical conditions where the CDC recommends that people not get vaccinated. If there are any possible exceptions or inherent risks, then informed consent is the only ethical option. The decision to vaccinate, the risks and benefits of that decision, and the intervention belong between a practitioner and patient, not in a mandated statute. Thank you for your time.
Thank you very much. Are there any questions? Thank you very much. All right, next is Kim Rosenberg, Mac Rosenberg.
Yes, thank you. Thank you. Senator Millett, Representative Cornfield, and distinguished members of the committee. I'm pleased to be back in a state I've visited many times, and thank you for allowing me to testify this evening. I'm here to testify in opposition to LD 798, and my written testimony also is in support of LD 987. My name is Kim Mac Rosenberg. I am an attorney with over 20 years litigation experience in products liability, insurance coverage, and vaccine safety. I currently represent a client in a fraud case against Merck in California related to the Gardasil vaccine. I'm also the co-author, co-editor of 2 books on vaccine safety and the author of a book about autism. Finally, I'm also the parent of a vaccine-injured and medically complex young adult. I'd like to briefly discuss 3 issues related to removing religious and philosophical exemptions tonight. I've cut back on some of my testimony that other people have already covered this evening. First, exemptions are necessary to balance Maine Health and Human Services' power under the Education Code to add new vaccines to the schedule without meaningful public input, including public hearings. This end run around the legislative process divests you, the legislators, and stakeholders such as parents, scientists, and medical professionals from participating in a decision that affects the health of Maine's children, and it shouldn't be taken behind closed doors. The regulation isn't just a paper tiger. HHS used it a few years ago to add a Tdap dose to the schedule without any authorizing legislation and without public hearing. Other vaccines can similarly be added to the schedule using this regulation. So even if you approve of the current mandated schedule, what happens when a new vaccine is added, or many new vaccines with the hundreds that are in the pipeline? One vaccine that's likely to be lobbied heavily is Gardasil 9, a vaccine meant to treat HPV infection. It's the most expensive vaccine on the pediatric schedule, and a mandate in any state is a financial windfall to the manufacturer. The vaccine has never been proven to prevent a single case of any type of cancer. In fact, it only protects against a few types of HPV, not even all types associated with cancer. And like all vaccines, it's not 100% effective, and we don't know the length of protection. We do know, however, that tens of thousands of people have reported injuries, many serious, including over 460 deaths. Second, LD 798 violates federal disability laws, including the Individuals with Disabilities in Education Act, Section 504 of the Rehabilitation Act of 1973, and the ADA, the Americans with Disabilities Act. It flies in the face of those laws intended to protect children with disabilities and their right to a free and appropriate public education. Under the proposed law, the state will condone disparate treatment of children with disabilities, while allowing children with IEPs who currently have exemptions to continue to attend school. It does not allow future IEP students or current or future 504 plan students, all of whom are also entitled to a free and appropriate public education, to attend school. Litigation on behalf of children with disabilities likely will follow if LD 798 is passed. Finally, by treating healthy children with exemptions as inherently infectious and contagious, and by permanently excluding them from school for fear of contagion, the state has actually placed them in a protected category. The Americans with Disabilities Act, Section 504 of the Rehab Act, and state law, the Maine Human Rights Law, protect you not only if you have a disability, but if someone thinks you have a disability or treats you as if you're disabled. Thus, the law forbids discrimination against a person for fear of contagion. Indeed, our Supreme Court has recognized that, quote, few aspects of a handicap give rise to the same level of public fear and misapprehension as contagiousness. Unvaccinated children are being treated as if they are diseased and dangerous. However, their perceived contagiousness, albeit baseless, puts them in a protected class, precluding discrimination against them, precluding their exclusion from school. We allow children who have hepatitis B or who have HIV/AIDS to attend school. As we should, those children should be allowed to go to school. How can we exclude healthy children simply because of their vaccination status? I also, very quickly, want to correct some misconceptions about the Vaccine Injury Compensation Program. It is not a no-fault program. It's actually very contentious, takes years to get through, does have a causation requirement, also has very limited statutes of limitation.
All right, thank you very much. Are there any questions? Thank you very much.
Thank you very much.
Mike McClone, the Honorable Mike McClone.
You want to explain?
Yes. It's a tradition around here that if you've been on a certain committee and you come and testify before your old committee, you bring them treats.
I trust you'll pass them around.
Yes, thank you very much.
It feels kind of late at night to be doing that. And I want you to know that I actually surveyed some members on the committee as to what people wanted.
You should have brought some coffee, Mike.
Actually, the little baggies, my wife did that. They are the chocolate coffee beans. That was Rep. Sampson's recommendation.
Before you start, I want to call up also Patricia Noble and Jack Noble can come to the front of the room. Okay.
Well, Representative Kornfeld and esteemed members of the Joint Standing Committee on Education and Cultural Affairs, my name is Mike McClellan, and I'm the Policy Director for the Christian Civic League of Maine. Today I speak to you strongly urge you to defeat LD 798. The Christian Civic League, founded in 1897, is a nonpartisan, nonprofit research and education organization dedicated to the preservation of the family and Christian values. And I'm going to kind of focus on the religious piece today. Christian Civic League of Maine is not against vaccinations, very clearly, and I also personally, like many people today, I did vaccinate my children when I had that time. It is easy to document that vaccinations have helped us in humanity. We are against this legislation in part because of the ambiguity and broadness of the language. We're certainly against this language as it clearly seeks to remove religious rights and sincerely held philosophical rights of the people of Maine. And we believe that these rights did not come from the state of Maine, and the state of Maine has no right to take them away. To take even one of these rights would be a far overreach by the state, but to seek both of them is pretty incredible. Now, when I was researching and talking to people that were proponents of this bill, I heard the argument that it was said that the church doctrine speaks nothing about vaccinations, or in fact supports it. I would point out that many churches in Maine are non-denominational, and many of us know that from the beginning of the church, it was not the building or the place that was the church, or was viewed as the church, but it was actually the individual believer or the person who is truly the church. So we each then, coming together, hold some things to be sacred truth and others debatable. I see the use of vaccinations on our children as a religious belief that not all of us hold, but is important because some do hold it. Now, a few years ago, the League supported LD 426, which was sponsored by Rep. McRae, actually. If you remember, it sought to allow people who had a religious belief not to wear the color hunter orange, but instead wear red. Now, the League, we supported that legislation, not because we had color issues in our belief system, but because it was a religious belief that was sincere to these people. Please understand, our religious beliefs and our rights would have been weakened if we'd chosen not to support everybody's religious beliefs and rights. So in closing, I did a lot of research. I guessed there'd be some amazing science stuff, so I didn't even try to play with the science. It's been incredible today to hear both sides. The stories have been really passionate, and I'd be another person I commend the committee for sticking in here and for running a really good hearing today. In closing, though, I did research quotes from our founding fathers in terms of religious liberty and freedom, and I just put two on for you. One is a founding father, James Madison, who said, "No power over freedom of religion is delegated to the United States by the Constitution." Thomas Jefferson said, "Rightful liberty is unobstructed action according to our will within limits drawn around us by equal rights of others. I do not add within the limits of the law, because law is often but the tyrant's will, and always so when it violates the rights of the individual." So to us, it's clear that the Founding Fathers viewed the rights of each individual to be sacred. Please join me and vote against LD, it's 798, yes. And again, thank you for your time and consideration today.
Thank you very much.
And I was within 7 seconds.
I'm impressed.
That's the, no, I won't say it.
Are there any questions?
Oh, good. Thank
Thank
my
you
wife.
very much.
Okay, God bless you guys, thank you.
Julie Anderson. Then we'll have Erica Jason.
Hi. Good evening, Senator Millett, Representative Cornfield, and distinguished members of the Education and Cultural Affairs Committee. My name is Julie Anderson. I live in Leamington, and I'm requesting you vote to oppose LD 798. I am an RN, currently working as a home health nurse. My previous position was in a hospital setting. And while there, I cared for a woman in her 70s who received the flu vaccine and within 24 hours had developed Guillain-Barré syndrome. The CDC admits that GBS is a potential risk associated with the influenza vaccine. GBS is a rare disorder in which a person's own immune system can damage their nerve cells, causing potential muscle weakness and sometimes paralysis. My patient initially experienced lower limb muscle weakness that eventually developed into paralysis. She was admitted to the intensive care unit and placed on a feeding tube and ventilator to stay alive. Although she eventually recovered after a month of hospitalization and therapies, she had residual muscle weakness and pain as she continued with therapies and nursing care at my hospital. You've heard it a lot today. I'll say it again. There is risk involved with any vaccine, and where there is risk, there must be a choice. Personally, I have received the flu vaccine one time in my life. I was in bed for 5 days. I could barely get up to use the bathroom. I have never been so sick in all my life, and I will never again get the flu shot. But if this bill passes, I can first see in the near future state law mandates for flu shots for all healthcare providers. If so, I would be forced into getting the flu shot to keep my job, a complete violation of my constitutional rights. I would not comply, and so would then be forced to quit my job. I would have to move my husband and our 3 publicly educated children out of Maine and look for work elsewhere. Can Maine afford for RNs and their families to move out of the state? We already have a nursing shortage. In 2015, the RN shortage was 600. A report issued by the Center for Health Affairs and Maine Nursing Action Coalition projects a nursing shortage of 3,200 RNs by 2025. This growing shortage is putting a strain on medical institutions and their employees while threatening patients' future quality of care. It is a well-known fact that Maine is not graduating nursing students quickly enough to meet the already growing demand, and if this bill passes, will certainly deter more nurses from seeking employment here. Is this really what we want for Maine? If this bill passes, I will no longer feel welcomed here in Maine and will be forced to move to a state where individual rights and freedoms are encouraged. I implore you to maintain the rights of all Maine people and oppose LD 798 in support of LD 987. Thank you.
Thank you very much. Are there any questions? Thank you very much.
Thank you.
Before we call up the next person, would Ashley Roberts and Warren from Westbrook, because we cannot read your last name. So Warren from Westbrook, please come to the committee room in the front row. Madam Chair.
Okay. Erica Jason. Erica Jason. All right, we'll circle back to her. Dr. Patricia Noble.
Good evening, Senator Millett, Representative Cornfield, and members of the Committee on Education and Cultural Affairs. My name is Dr. Patricia Noble. I live in the town of Lincoln, and I'm here to testify in support of LD 798, which would disallow non-medical exemption from vaccination to attend our schools. For the record, I oppose LD 987. And incidentally, I want to add, professionally, as a practicing pediatrician for 4 decades, I've never had one of my recommendations for exemption for vaccination be declined. And so I've heard a lot of people saying that that was their experience, but it's not my experience or any doctor I've chatted with. Anyway, personally, my dearest friend had polio as a child and was severely crippled as a consequence. She made sure her children were immunized. Ironically, because the vaccines work so well, society's become complacent about the vaccine-preventable diseases. It's true that those who get disease naturally survive and have immunity. What people don't see are the infants, children, elderly, and others who died from the disease. Rarely nowadays do people see the ones who survived, like my friend, suffering significant lifelong consequences. Taking measles as an example, worldwide still a leading cause of vaccine-preventable death, especially in children. It's not benign. Historically, never exposed populations, including our Native Americans, experience catastrophic death rates as high as 2/3 of their population when exposed to the measles. And incidentally, once somebody is infected with measles, we don't have any specific treatment that's effective for the disease, supportive treatment. But we don't have an antibiotic for it, like for strep throat or something like that. The complications to measles include pneumonia, blindness, hearing loss, damaged immune response, and brain inflammation. Read that, encephalitis. In the United States, the fatality rate is about 3 per 1,000 cases of measles. It can be as high as 28% in developing countries. Those at the highest risk for complication from measles include children under 5 and immunocompromised persons, such as those undergoing cancer treatment. And for these, the fatality rate in the United States today is 30%. I've heard it mentioned today that there haven't been any measles cases or deaths in the United States. In 2014, a woman died who was immunocompromised from measles in Ohio. So,
Make sure you speak into the microphone.
Okay,
Because
I'm sorry.
people are listening to us,
yeah, okay.
or you.
In a state like ours with high cancer rates and high rates of immunosuppressed individuals fighting for their lives, the potential consequences of an outbreak are horrible to imagine. We have an effective and safe vaccine and have had for 50 years. The life-threatening reaction rate to measles vaccine is less than 1 in a million. Compare that with these numbers that I just gave you for the real problems from the disease.
Okay,
Anyway,
just wrap it up.
wrap it up. I want to keep our schools safe. We want to protect them from getting measles from incoming travelers from afar, even though it's not endemic here, it's brought in by the next plane flight. And particularly since schools are a source of community get-togethers, teachers, parents, etc. And amongst those are immunocompromised patients,
All right.
people.
Thank you very much. Are there any questions? Dr. Noble. Dr. Noble, Dr. Noble.
I'd like to thank the committee for listening. I'm not a pediatrician. I am an older, now retired general surgeon from Lincoln the past 25 years. And I'd just like to remind the people present and listening of the scourge of polio, which is unheard of now in the United States, but it still exists in the world, and the world is connected, and people travel back and forth from Africa and other places where it is still prevalent, and therefore people in the United States who are not immune might very well be exposed to that disease. And it's a terrible disease. It made an indelible impression on me early in my training when I had the experience of visiting the medical ward full of giant iron lungs that people lived in. This is 10 years after the Salk vaccine and the other vaccines that came out later. And it was a terrible scourge. And because it became prevalent, and I don't know all the rules, but probably mandatory in many places, there was sufficient herd immunity that very few people in this world have seen that room full of those people in iron lungs, living their life perfectly sentient, completely paralyzed, in a machine. They never get out. And that's the benefit that you get when you mandate and develop herd immunity. Thank you.
Thank you very much. Are there any questions? No questions. Thank you.
Okay, Emily Rhines, Emily Keller, Gabriel Harpel, or from Waterville, Adrian Carmack from VZ, and Deb Dietrich from Cumberland. If you could please come to the committee room in the front row. Emily Rhines, Emily Keller, Gabriel Harple, Adrian Carmack, and Deb Dietrich.
Ashley Roberts?
Thank you, Senator Millett, Representative Cornfield, and distinguished members of the committee. In light of all the people waiting to testify, I will attempt to keep this short and sweet. I am on 2 of your lists to testify on both bills. I will offer 1 testimony on both pieces of legislation. My testimony is in opposition to LD 798 and in support of LD 987. For me and my family, I'm here testifying on, I'm sorry, my name is Ashley Roberts. I'm from Gorham. Oh, sorry, it's been a long day, as you all know. My name is Ashley Roberts, and I am a lifelong Mainer. I was born here, raised here, educated here, and have built my career here. I have always looked forward to raising a family of my own here. For me and my family, these bills are not political, but deeply personal. When I was 16, I was injured by the Gardasil HPV vaccine. I'm one of the 60,000 plus individuals in the United States injured by that vaccine. Because of this vaccine, I have multiple life-threatening allergies, an autoimmune disease, and other chronic health problems ranging from debilitating migraines to cardiac and reproductive disorders. My medical history puts me and any future children I might have at an increased risk of medical complications, injuries, and death from any vaccines we receive. Despite these contraindications, I nor my future children are eligible for a medical exemption. Further vaccination is not a risk that I or my husband are willing to take. It is well known and often discussed that Maine has a problem retaining young professionals and young families. If this bill passes, my husband and I will be left with no choice but to leave the state we love so much and to move our family, our income, and our small business to a state that will respect our right to make medical decisions about our own bodies. I know that there are other families like ours who will face the same decision. If this bill passes, Maine will lose a lot more than students no longer attending our esteemed Maine schools and colleges. Maine will lose families, small businesses, young professionals, jobs, and its very future. For the sake of my family and our small business, I respectfully urge you to vote no on LD 798 and yes on LD 987. Thank you.
Thank you. Are there any questions? Thank you very much.
Thank you.
Now we'll go to Warren from Westbrook. The Warren, no, go ahead. Okay. All right, Emily Rhines.
Good evening. Senator Millett, Representative Cornfield, and distinguished members of the Committee of Education and Cultural Affairs. My name is Emily Rhines, and I'm the Director of Health at the United Way of Greater Portland. I have 20 years of experience in public health, and I'm the parent of 2 school-aged children. I'm here today on behalf of United Way of Greater Portland to testify in support of LD 798. United Way of Greater Portland has a commitment to make Cumberland County stronger for everyone who calls it home. More than 225 businesses, nonprofit, public, and community organizations have endorsed 3 10-year goals that promise measurable and meaningful change. As a trusted community organization, I want you to know that we see this as an issue about safe schools. Community immunity is needed to protect those who cannot be vaccinated. Not immunizing children puts Maine's most vulnerable residents at risk. Children need to be able to attend school without the fear of getting sick. Schools have a responsibility to provide everyone a safe environment, and one way to ensure that is to keep vaccine exemption rates low enough to promote that community immunity. These vaccination rates are particularly concerning to me on a personal level, based on a scary situation that I experienced as a high school student in 1994. An unvaccinated classmate was thought to be exposed to measles, and you can read about this in my testimony. I'm going to forward through that. But ultimately, my school community was safe because the majority of the school community was vaccinated, and thankfully no one contracted that disease. Much has changed since then, and we are currently watching a public health emergency unfold in the state of Washington and other areas of our country. Vaccines are one of our greatest public health and medical breakthroughs, and now Maine's low vaccine rates are putting us in real danger. Thankfully, this is entirely preventable, and Maine legislatures have an opportunity to address this critical issue. Ensuring that all children are immunized as a condition of school entry is common sense and evidence-based approach to ensuring the health and well-being of Maine's children and our most vulnerable neighbors. For these reasons, we respectfully encourage you to support LD 798. Thank you for your leadership and service.
Thank you very much. Are there any questions? Thank you. Now we'll have Emily Keller.
Good evening to Senator Millett, Representative Cornfield, and the members of the Joint Standing Committee on Education and Cultural Services. My name is Emily Keller, and I am a resident of South Portland, Maine. I'm here to testify in support of LD 798 as a pediatrician and a community member. I'm going to deviate just briefly from my testimony to just mention that, to bring us back to that the bill and the vaccines covered in this bill are ones that can spread most easily in a school-based setting, and that the bill is referring to the vaccines of diphtheria, tetanus, pertussis, the MMR vaccine, measles, mumps, rubella, to polio, and to the chickenpox vaccine, and to the meningococcal vaccine. It is not addressing some of the other vaccines that have been brought up in stories tonight. So getting back to my testimony, when I see a patient, I consider the whole child in front of me, thinking about their physical, mental, and emotional health, and the social determinants that impact their well-being. For some families, religion is one of those determinants. While it may feel uncomfortable to pass a law that eliminates a religious exemption for vaccines, many religious authorities have weighed in and have offered guidance. Vaccines do not contradict the doctrine of major religions. I do not claim to be an expert on theology, but I have looked into the issue of vaccines and religious beliefs as it has come up in the care of some of my patients. The religious issue I've had the most experience with is in regard to gelatin. Gelatin, derived from pig connective tissue, is present in some vaccines as a stabilizer to protect the vaccine's active ingredients from degradation. As it relates to the vaccines in the bill, gelatin is present in 2 of them, in the measles, mumps, rubella vaccine and in the chickenpox vaccine. Some faiths, such as Islam and Judaism, prohibit the ingestion of pig products, so there is concern that use of gelatin-containing vaccines may violate their religious law. However, these religious groups have approved the use of gelatin-containing vaccines for a number of reasons. One is that the gelatin is not being consumed. Another is that the gelatin in vaccines has been purified and processed to render its properties significantly different from that of dietary pork. And thirdly, because the benefits of such vaccines for the health of oneself and others are felt to outweigh the adherence to religious laws. Another concern raised by some faith is the use of human fetal cell lines to create certain vaccines. These fetal cell lines trace their origins back to 2 elective terminations in the 1960s in Sweden and the UK. Fetal cells are unique in that they can replicate themselves many more times than other types of human cells. This regeneration capability makes them an ideal cell for producing certain types of vaccines. Today, descendants of these cells are used to produce 2 of the vaccines related to this bill, the rubella vaccine and the chickenpox vaccine. Some faiths, such as Catholicism, have beliefs against abortions, raising the question of whether these vaccines can be given without violating religious law. In 2005, the Pope reviewed the issue and determined that such vaccines are permissible given their life-saving potential. The intersection of the issues of vaccination, religion, public health, and individual freedom is complex. My medical training has taught me to embrace the complexity, think critically, and weigh the risks and benefits of available evidence to make decisions that best serve my patients. Vaccines are in my patients' best interests. They're overwhelmingly supported by pediatricians who you've heard of many tonight, and then I'll just point out that they've all been speaking in support of LD 798. And I'll leave it at that.
All right, thank you very much. Senator Pouliot.
Thank you, Dr. Keller. We did hear from some doctors, though, licensed medical professionals today that vaccines are in the best interest of their patients, but they don't believe that they should have to vaccinate. So since you're a medical professional, they're a medical professional, you're both practicing in Maine, you're both advising people about ways to be healthy and take care of themselves, why the disconnect? And then secondly, if you could just address the herd immunity piece. We've heard that 92 to 95% is required to maintain herd immunity. We've heard that Maine has a rate of 95%. So why the need to vaccinate more if we're at a percentage that would provide that immunity?
Sure. And I'll maybe start with your second question first in regards to herd immunity. And I don't have an answer into the background on that terminology and the research behind how that terminology came, but I will address the 95% specifically, and that's been cited many times this afternoon and evening. And that's looking at the state as a whole. And when you break that down and look at pockets, and I think it was mentioned that there's some data available at the school level and county level to get more information about specific regions of Maine and their exemption rates, that's where there's pockets where the exemption rate falls below that 95%. And so those pockets falling below that rate has been, translates to the outbreak in the Pacific Northwest. It's, you know, looked as a whole, that it's really the locations that have pockets of the lowest immunity that have had the outbreaks. So yes, it's not incorrect what people have been saying about 95%, because at the state level that's an accurate reflection. But when you break it down by regions, by county, and by school level district, it's a different number. So hopefully that helps address that piece. And can you remind me of your first question?
Yeah, just, you know, there just really seems to be a disconnect amongst medical professionals about this, you know, need to vaccinate. And it's difficult for me when, moving aside philosophical reasons, moving aside, you know, personal beliefs and all that kind of stuff, and just focusing on the science, which we're being compelled to do.
And I would say I would argue that there hasn't been a disconnect presented by pediatricians who are on the front lines of caring for children, that the overrounding our stance is that vaccines are in the best interest of children's health. And I know that, again, as it's been mentioned tonight, everyone here has that at the forefront of their mind. So I haven't heard that disconnect presented by any of my colleagues in pediatrics. You know, and I think in general, what has been brought up in terms of there are certain individuals that have medical reasons why they should not have vaccines, and that we are open to having that discussions. And to be quite honest, I've never been asked to write a medical exemption, but I am open to that conversation. And I have also not been practicing as long as some of my other colleagues, so they can speak to that a little bit more, the individual experience of writing that exemption. But I'll just again say that from the pediatricians that you've heard from, there's not a disconnect.
All right, thank you very much. Are there any other questions? Okay, thank you.
Thank you.
Gabriel, is it Harpswell or Harpwell or Marple, or I can't tell, is the M or an H? From Waterville. Gabriel. All right, we'll come back to that one. Adrian Carmack.
While we're waiting for Ms. Carmack, would David Whitney, Colleen Oliver, Sane Oliver, Cameron Plord, and Kara Sachs please come to the committee rooms in the front row, please?
I can start. Good evening. My name is Dr. Adrian Carmack, and thank you all for being here. I'm a pediatrician, and I practice in Bangor, Maine, at Penobscot Community Health Center, a federally qualified health center serving a large region of Maine. My husband and I moved to VZ with our 6 children in 2005. I first want to tell you, before I get started, about a retired pediatrician who lives at Dirigo Pines, where my father-in-law lives. Dr. Ron Stryer could not be here, and he asked me to tell you about his first year of residency in 1955 at Baltimore City Hospital. His first year of residency was the year that the Salk vaccine was introduced, and at Baltimore City Hospital, all the patients for the state of Maryland who had contracted polio were admitted to the hospital. There were over 100 patients with paralysis. By his third year of residency, there was not a single patient admitted with polio. Immunizations are one of the greatest public health accomplishments of our time. I graduated from medical school at Columbia University in New York in 1992, the year that the Haemophilus influenza B vaccine was introduced. During my medical school time, I actually saw many patients with Haemophilus B. Over the span of my medical career, the vaccines for rotavirus, varicella, influenza, hepatitis A, hepatitis B, and HPV have become available. Through my career, I have witnessed the devastation from these diseases, and I have witnessed the benefit of these vaccines. In 2009, when the H1N1 virus spread through our country, I was asked to help the Bangor Health Department to have a shot clinic that was offered for the region. It was held at the Bangor Auditorium. As I drove across town, I wondered how many people would show up, with people being concerned about vaccines. I can still remember the feeling when I pulled up to the Bangor Auditorium and the crowds were circling the building. There were more crowds than we saw today. It was an unbelievable experience. I was assigned to help immunize the children who were not able to come into the building because of their medical conditions. So we went from car to car to give the vaccines. When vaccine-preventable disease is bearing down on our communities, our public health system was able to mobilize and immunize and save lives that year. So often when I'm faced with a decision about a treatment, parents ask me, what would I do? I do not hesitate when it comes to vaccines. In fact, at the last count, my 6 children have had 211 vaccines. Thankfully, I have healthy children, but and my children have not needed a medical exemption, and I would very easily talk with a family. Most of my families have concerns, and I work with them to do the schedule that they need. And if they needed a medical exemption, I would work with them. So I haven't had the experience that we heard today of people not getting exemptions. As a physician and a mother, I know that vaccines work, vaccines are safe, and vaccines save lives. Thank you.
Thank you very much.
Okay.
Are there any questions?
Thanks.
Senator Pouliot.
Well, I have a question about, okay, so if you have somebody that's got an autoimmune disorder and they can't get vaccinated,
Yes.
right? I just want to make sure I'm learning a lot today. I feel like I'm going to medical school for free. So if the person has an autoimmune disorder, right, and they can't get vaccinated, can they like contract measles or something and then get other kids sick? Or, I mean, how does that work? Help me out.
So you mean if they haven't been vaccinated?
Right.
So if they haven't been vaccinated, then they are at risk of getting the disease. And then if they have the disease, then they are at risk of spreading the disease.
Okay, so the kids that can't get vaccinated could be just as bad, if you will, as the kids that are choosing
Nobody's
not.
bad.
Well, I don't know what
No,
else.
and I think
you know
we
what I
should
mean?
clarify that,
Yeah,
that we're
okay.
not labeling kids as bad.
As dangerous.
Right.
Okay,
right.
as kids that are choosing, or their parents are not vaccinating them.
They are at risk. So what is the question?
I guess what I'm asking is a child that has an autoimmune disorder that can't get vaccinated as dangerous as a child that is not vaccinated?
So if anyone who is who is not vaccinated and can contract a disease is also a risk to the public to
So
spread the
what
disease.
percentage of the population has an autoimmune disorder where they can't get vaccinated?
So that answer, I don't know the percentage.
Could we find out for the work session? Because if there's
The
like
number-
5%.
You don't need to
Not
answer
you,
that.
but
Yeah,
I'd like to know
the
from
number
somebody.
of
I'd really like to know.
of children
because-
that need medical exemptions.
Right. No. Yes, I guess that's correct, yeah, the percentage. Because if there's like 5% of kids that need a medical exemption that can't get Now, how are we going to get any better than the current rates that we have right now?
Because
other than
I
maybe a
don't think the
small
number's that
percentage?
high, but we'd have
I'd
to
like to
find out.
know, yeah,
Right.
thanks.
You don't need to answer that. Our analyst will
Great.
work on that. Thank you very much.
Okay.
Deb Dietrich. Oh,
Do-
he's just standing, he doesn't need attention.
So in full disclosure, I have testimony of my own, and I also have testimony that I have been asked to read from a colleague, and if I have to choose, I will prefer to read her testimony as opposed to my
Well, in
own.
full disclosure, you have 3 minutes, you can
Okay.
choose.
All right, so my choice then will be to read her testimony because I
Fine.
think it's more compelling, and I will give you my written testimony. So, good afternoon, good evening, Senator Millett, Representative Cornfield, and members of the Joint Standing Committee on Educational and Cultural Services. My name is Deborah Dietrich, and I'm a resident of Cumberland, and I'm here to provide, I'm going to be speaking in support of LD 798 on behalf of my friend and colleague Jerry Brooks Greenwell, who is a resident of Bethel. I am a public health professional myself with more than 35 years of experience. I recently retired from the Maine Health System as Senior VP for Community Health. I'm a founding member of the Maine Public Health Association, et cetera, and I'm also the mother of a fully vaccinated 21-year-old, so just in terms of context. So now to Jerry's story, and she was very apologetic that she couldn't be here today. Our son Jerry awoke the morning of April 11th, 2003, with what he thought to be a case of the flu. Upon his girlfriend's return home that evening, with the discovery of a rash on his leg, she immediately called her mother, a registered nurse, who advised her to seek medical care for him. It was then they realized that Jerry couldn't walk or stand, and his roommates literally had to carry him to the emergency room. He went to the critical care unit at Maine Medical Center, and they started administering huge doses of antibiotics to fight the progression of the disease. My husband and I arrived from Bethel, and all too soon it was determined that they would need to put Jerry in a medically induced coma. We had no idea this would be the last time we heard his voice. As we stood by, unable to do anything, we watched our son fade away before our eyes. How could our beautiful 6'3", solidly built, exceptionally young and healthy child possibly be this ill? Hours passed, he was drifting further and further away. And then on April 14th, we suffered a devastating loss. Despite treatment and around-the-clock care, our son was gone. Despite our enormous loss, we were shattered to learn this disease was potentially vaccine preventable. Our knowledge then and our continuing efforts now are exasperated even more when one considers the fact that our state has it within their power to prevent such a tragedy from happening to other families. So I'm going to stop there, but so Jerry had a meningococcal disease that can strike in preteens. It has been somewhat common in college students, et cetera. There is a vaccination for it. It is part of the bill that is being discussed here today. And Jerry's very fervent hope is that this bill will be passed and that people like her son will be prevented from experiencing this fatal disease. So I'm not going to take questions that would be directed to Jerry, but I'd be happy to take any other
All right.
questions.
So those of you that are listening, it was Jerry the mother with an I and Jerry the son with a Y.
Exactly, yes. And again, Jerry's from Bethel. She's been a very big advocate at the national level, and I passed out a letter from the National Meningococcal Association, et cetera, on this issue.
Thank you. Are there any questions? Thank you very much.
Thank you.
Next is... It doesn't matter. Here. David Whitney.
I brought with me testimonies from Senator David Burns of Whiting, Caleb Pippin of Northfield, Sean Goodwin of Bangor, Charles E. Davis of Marshfield, Holly Jan Greenleaf Whitney of Marshfield, and Colton Winslow Whitney of Marshfield. Senator Millett, Representative Cornfield, distinguished members of the committee. I'm David Whitney, and I am testifying in opposition to LD 798. I am a fourth-generation business owner in Washington County. I started my enterprises in 1988 as a junior at the University of Maine at Orono, a family tradition. Since that time, my wife and I have built our enterprise to be several businesses, and we employ a total of 400 people on an annual basis. In 2007, we won the Family-Owned Small Business of the Year award from the SBA. From 2010 until 2018, I served on the Board of Trustees of Down East Community Hospital, the final 4 years as board chair. My daughter, who had to leave, she was here. She's a sophomore at Washington Academy. She's a high honor student. She plays tennis and soccer. She's in the sustainability club. She's loved by her friends and her teachers. My son, Colton, is in the 7th grade at Rose M. Gaffney School in Machias. He's a high honor student. He's in the Gifted and Talented program. He's in the Junior National Honor Society. He plays every sport. He's a coach's dream. My son, Ashton, plays the trombone. He's in 6th grade at RMG. Plays 2 sports. He's beloved by his teachers and his friends, and he's the family entertainer. My wife has wanted to have the conversation with me, what would happen to our family if this bill passes? And I have not wanted to waste a breath on it. But now, for the first time, my wife is going to hear me. Holly will have to resign her job as mental health counselor at Washington Academy, a job she's held since 2001. This will leave 60 of her clients in a lurch, 15 of which are Native American. My kids will be devastated. Holly will have to move with them to Pennsylvania, her home state, which will leave me with my enterprises in Maine while my family is in Pennsylvania. Now you tell me what I'm going to do. I love my family, I love my business, I love my employees, and I am not in control over this decision. This decision is yours. I can only make decisions on those matters that I have control over. My family, our place in Maine, and indeed our enterprises hang on your decision. I implore you to vote no on LD 798. Thank you.
Thank you. Are there any questions? Thank you very much. Colleen Oliver.
Good evening. Colleen Oliver, Bath, Maine. Marbury v. Madison. All laws repugnant to the Constitution are null and void. The United States Constitution is the supreme law of the land. Congress shall make no law establishing a religion or prohibiting free exercise. State of Maine Constitution. All individuals have a natural, unalienable right to worship Almighty God, according to the dictates of their own conscience. No person shall be hurt, molested, or restrained in that person's liberty. You all took an oath just to that piece of legislation, that piece of the Constitution. All of you did, and all the signers of this bill. These laws are self-evident. The people must never acquiesce in any violation of the Constitution. You cannot legislate, mandate, regulate my family's Christian beliefs to not inject or ingest aborted cell line products and DNA with fragments of aborted children as to the dictates of our conscience, as per the Constitution of the state of Maine. Maine v. Casey Hickox, notations, opinions, and rulings. The state of Maine failed to prove that there was a public health risk, even with the exposure to Ebola. Judge Laverdier. Maine's medical witnesses are grossly unqualified. The case affirmed that the personal civil liberties are an appropriate grounding for appealing the situation whereby a government motivated by irrational fear, anti-science, or political attempts to infringe civil liberties under the National Emergencies Act 201 and 301, only the President of the United States can declare a pandemic. I, Colleen Oliver, address all sponsors of Bill 798. Section 5, Maine Constitutional. Removal by address. I charge you with dereliction of your oath of office by attempting to mandate our constitutional freedoms.
Could I stop you for a minute? You're really attacking the representatives.
I'm not trying to attack anybody.
Since 1 o'clock, every single person on this committee and in this audience has been civil, and it has been a pleasure to listen to them. But this is really...
I'm sorry, I'm not pleasurable.
I didn't say you weren't pleasurable. I think you're being a little uncivil toward the representatives.
I will lower my voice.
I don't think that you're borderline attacking these people and saying that they should be removed by impeachment.
Okay. Then I'll strike that and I'll continue on.
Okay, fine.
You're attempting to usurp the U.S. Constitution. You're attempting to usurp the Maine state constitution. You're attempting to usurp the compulsory education law. You're attempting to harm Maine children by violating Nuremberg codes. There's no study of unvaccinated children at the age of 4 to receive 21 to 34 injections at one time. Number 5, violation of the Religious Freedom Act, H.R. 1308. This is sedition by its very definition. All power is inherent to the people and in the people. They have an unalienable right to institute government and reform or totally change the same where safety and happiness require it. You spit in the face of every veteran.
No, I'm sorry. You're
who
done.
has fought for our freedoms.
No, I'm sorry. Please. That's enough. Thank you very much.
Before we begin, I would like to call Eliza Donahue, Sharon Matthews, Tony Owens, Jennifer Riggins, and Eliza Met, or Mate. I apologize for the mispronunciation. Please come to the committee room in the front row.
Good evening. Representative Cornfield, Senator Millett. I'm Zane Oliver, Bath, Maine. I'm a descendant of the Popham colony in Phippsburg, Maine, 1607. I spent 25 years in the United States Navy protecting our constitutional freedoms from all enemies, foreign and domestic. Bill 798 to me represents tyranny because it's trampling on our religious freedoms, period. My family has served this country and this state for 412 years with honor, dignity, and devotion. My oath never expires. So I stand before, you're not going to like this, I'm going to say the same thing my wife did. All sponsors and co-sponsors of this bill.
Civility, please.
I am being civil. I'm not yelling.
No, you're attacking the
I am not attacking
representatives.
anything. I am stating a fact. The people have the right to make any and all changes to this government as the safety and the happiness of their families compel us to. Period.
Thank you very much. Are there any questions?
I will not.
Cameron Plord.
Hello, Senator Millett, Representative Cornfield, and the distinguished members of the Education and Cultural Affairs Committee. My name is Cameron Plord. I am an 18-year-old high school senior, Eagle Scout, resident of Cumberland, and registered voter, who has been accepted to the University of New England, where I plan to pursue a Bachelor's of Science degree in dietetics. I am here today because I strongly oppose LD 798 and because I support LD 987. All Americans have the right to medical freedom and to choose which interventions are appropriate for them. If LD 798 passes, I will be forced to leave Maine to pursue my post-secondary education in a state that respects my liberty and my right to make educated health decisions that benefit me. The University of New England is my top choice of colleges, and I have worked diligently over my high school career to be accepted there. It is unfair that if LD 798 passes, I will not be able to attend. As an Eagle Scout, I took an oath to keep myself physically strong, mentally awake, and morally straight. By opposing LD 798, I am honoring that oath. As a citizen of the United States of America, I have the right to informed consent and the freedom to make medical decisions that are right for me. There is no one more invested in maintaining my physical strength and mental acuity than me, and I plan to do so in a responsible and educated way. Please vote no on LD 798. Thank you for your time.
Thank you very much.
Thank you.
Yeah, Senator Pouliot.
Yes.
I actually attended my first Eagle Scout ceremony recently, and I just
Yeah?
want to say congratulations to you.
Thank you.
I know it takes a lot of dedication, and best of luck to you in the future.
Thank you. I appreciate that.
Okay, Kara Sachs.